Good evening, everyone. My name is Monserrat Oni, and I am here supporting In Our Own Voice in this conversation. We have been hosting several conversations to talk about Black reproductive justice, and this evening we'll be talking about Beyond the Bullet, gun violence and Black reproductive justice. So today we have three incredible people that will be hosting this conversation. Dr. Regina Davis Moss, who's the CEO and president of In Our Own Voice Action Fund. Angela Ferrell-Zabala, Executive Director of Moms Demand Action, and U.S. Representative Cori Bush. And now I'm going to turn it over to Regina. Oh, sorry. Want to be clear that this event is off the record. This conversation is off the record, and none of the comments that are made here have permission to be used in any press without explicit permission. So thank you all for your attendance, and we're excited to have this conversation with you.
Well, good evening, everyone, and thank you for joining part 3 of Rooted in Power, a Black Women's Reproductive Justice series. As previously stated, it's a 4-part discussion series ahead of the 2024 elections, and we're diving into some of the most important issues that will help you become informed and engaged when you visit the ballot box. So you'll be talking about reproductive justice. We'll be talking about the future of the movement. We encourage you to take a look at some of the sessions that we've already aired, as well as sign up for the one next week. We're bringing some of the most powerful thinkers to this work. And tonight, we're going to be talking about Beyond the Bullet, gun violence and Black reproductive justice. A little bit about the Action Fund. So some of you may know In Our Own Voice, National Black Women's Reproductive Justice Agenda, but we also have the In Our Own Voice Action Fund, which is the sister arm. And so what do? We are in both places, we're advancing reproductive justice. But with the Action Fund, we're educating and organizing the public, we're registering and informing and mobilizing voters. We're continuing to promote comprehensive proactive policy solutions to some of the most pressing issues facing Black women, girls, and gender expansive people, but we also work with reproductive champions like Representative Cori Bush and other ones at the state and local level to not only stand in solidarity with them as they continue to fight for these issues, but also during election times like this, we're promoting candidates that are committed to our vision of reproductive justice. So I don't want to, assume that people don't know what reproductive justice is. So let's just briefly give a quick definition of what reproductive justice is. So reproductive justice, and we're going to pull up this slide for those who don't know, is the human right to control our sexuality, our gender, our workplace, and our reproduction. That right can only be shared and can only be achieved when all women and girls have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, our communities, in all areas of our life, right? And so you're probably saying, like, what does that have to do with gun violence? Well, one of the third tenets of reproductive justice, which I believe is one of the most important, is the right to raise our children in safe and sustainable environments, right? And we can't raise our children in safe and healthy environments free from gun violence and free from harm at the hands of the law enforcement when there's no reproductive autonomy. They go hand in hand, they're inextricably linked. And so we're going to be talking more about that. So now, without further ado, what I'd love to do is introduce our panel. First up is Congresswoman Cori Bush. She's a registered nurse, community activist, organizer, mother, ordained pastor, and she represents the people of Missouri's 1st Congressional District. Congresswoman Cori Bush is in her 2nd term in the United States House of Representatives, serving on the House Oversight Committee, including as ranking member on the Subcommittee of Economic Growth, Energy and Policy, Regulatory Affairs, and the House Judiciary Committee. Welcome, Representative Bush. Also rounding out this panel is Angela Ferrell-Zabala. She is a passionate advocate. You've seen her probably all over your nightly news, but she is passionate about movement building, uplifting, and centering often marginalized voices and empowering the next generation of leaders. She has a background in political and social science, She began her journey into the world of social justice through many volunteer opportunities with a particular interest in women's rights, civil rights, the LGBT community, immigration, racial justice, education, the list goes on and on. She's a wife, a mother of four, and a lover of music, art, dance, and theater. And can I just say, on the camping trail, I've seen her dance. She is, you do not want to mess with her. She's got the moves. So let's get into this conversation. The whole point of this is that you are, maybe you're eating dinner, maybe you're, preparing your dinner, maybe you are working out. We want to, the point of this is that you're going to learn and that you're going to use this information and hopefully share it with your circle so that when you go to the ballot box, you're that much more informed. So without further ado, we'll get into the first question. So the first question for the evening is, and it's coming up. And while we're waiting for that question to come up, here we go. How does gun violence and the fear and trauma associated with intersect with, I'm sorry, and this feeling of trauma associated with it intersects with reproductive justice for Black women, girls, and gender expansive people? Angela, would you like to take that one first?
Sure, sure. I'm happy to jump in. First of all, thank you. And thanks for highlighting my dance moves. Unfortunately, I won't be able to do those tonight, but maybe on another session we'll do that. So yeah, this is a really an important question. I just think when we think about gun violence, and Regina, at the top, you gave the definition of reproductive justice, and I came out of the reproductive justice movement. And so that, I think about that when I think about gun violence and how what it means for communities and trauma, and the fact that Black women and Black communities aren't able to, because of a lot of the root causes of gun violence was housing insecurity and economic, all kinds of things, that disinvestment and divestment in communities leaves communities vulnerable. And when we think about what that means, the right to have a child and raise that child in safe communities, then we're losing that completely. It also tears communities apart. It tears family apart. It breaks community bonds. When it takes loved ones away, parents, children, siblings in Black communities, it happens so often, and it leaves families grieving and struggling to heal from trauma. And you have cycles, and sometimes it's generational and compounded trauma, which is awful. And we oftentimes, when we look at this, we look at it from the sense of the policy, which is important, policies that we can put in place that will save lives. We think about it from a justice perspective, from perpetrator, or how we're even kind of making the community whole, but we're not thinking sometimes, or not talking enough about what the healing part, what we need to do in order to heal communities. And so that's something that we're looking a lot into. The breaking of community bonds, when gun violence is constant, it breaks down the sense of safety and trust within a community, and people are afraid to let their kids play outside or go to school. I often say, as a mom of four, the sense that your kids can't be kids, Black children, particularly because when we look at this issue, they are disproportionately impacted. And so what does it mean to raise your child and not be able to raise them in a way that they can just be free and expansive and understand and see opportunity ahead of them when they have to kind of shrink themselves because of these things? And then again, generational trauma, as I said, it's the pain of gun violence doesn't just stop with one person. It ripples through families and communities and creates trauma that gets passed down to future generations. So there's a lot to grapple with. And I think I have been really proud to see leaders like Cori Bush and others that are thinking about the mental health implications and the trauma, and really how we're healing community, which is really important.
Thank you. Representative Bush, would you like to respond?
Sure. First of all, thank you for having me. It's so good to be here with you, Regina and Angela. It's always good to be able to learn from you. Let me just say that we all get to learn from you. Um, and I'll say, first of all, let me just echo everything that you just said. And, for those that don't know my background, most of my nursing career was in community-based mental health. I was the director of an agency. We had one was for youth and one was for adults. And we also had residential care. And one thing and this was in the city of St. Louis. And so one thing that I saw very often was the policy violence that, that was at the root causes of violence and the root causes of so much of this trauma. You know, I would see my patients hungry. And I know what that feels like because I've been hungry myself, where I was in a position where I only fed my children. There were days that I did not eat. I know what that's like. And I know what happens to you mentally when you lack food. And so when our children and our families are hungry, you know, when our children and families can't make ends meet, you know, that's trauma. When our children and families don't have stable housing, safe housing, that's trauma. When our youth are suspended from school over and over, and instead of being invested in and cared for, that's trauma. So from housing to healthcare to education to living wages, which we don't have for everyone. Our country is invested in perpetrating trauma rather than safety and wellness. And so it's our job to end the cycles of violence and trauma by enacting the comprehensive gun prevention legislation that we need for our communities, but that means working alongside. So you have your advocates, you have your activists, your local politicians, your state and federal politicians, your community leaders, your clergy. We all have to be working together in harmony, saying the same thing, that these community safety initiatives that we are fighting for, that we can't lose sight of how those conditions will continue to fester and grow if we are not paying attention to exactly where it comes from, where it stems from, what allows for it. And I'll end here with this. As much as we've been fighting for fighting against these loose gun laws in my state, in Missouri, as much as the densely populated cities are saying, no, 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 we need help, when our state is saying the opposite, that again, that there is more trauma, because you know, our communities are different, we have different needs, but the goal should be the same: to end this trauma and to end this violence.
Thank you. And I think you're really hitting on a key point here, which is that a lot of these things are systemic, right? A lot of, sometimes we want to play the blame game and say, if you just change this or change that, but it's difficult to change when it's a system that's set up a way that that's contributing to the disproportionate impact of gun violence on Black communities. Let's talk a little bit more about it. We always sort of went in that direction, but how do you believe issues of race, poverty, lack of access and resources play a role? And then further to that, if we can also talk about, are there specific ways in which gun violence can disrupt Black reproductive futures, like our reproductive decision making, including access to prenatal care, safe children, and healthy parenting, safe childbirth? Yes.
Well, Regina and Representative Bush said a lot of this, but I just want to go back and just talk about what it looks like when you disinvest in communities. And that means we're giving people fewer opportunities and resources. And just imagine this. We've done some work with young Black leaders in particular cities. Baltimore, we've done some stuff piloted in Philly. And when I had an opportunity to I spent a day with young folks, I want to say between the ages of maybe 15 or 16 to 23. And we walked all throughout different neighborhoods in Baltimore. And these young people had 3, 4, 5 times over survivors. They have seen people shot and killed in front of them, have lost siblings, parents, friends. And what this does to you when you think about trauma is it literally shrinks their possibility in their world. And so it almost it creates a condition that's ripe for more violence or more struggle in community. Because I remember having a conversation with a young man, his name is Tone, and he was saying, I happened to ask him a question about, what do you think about the future? What do you think about when you're this age? Just some generic question that you ask young people. And he couldn't even fathom making it to 25. And so I'm just thinking about all these factors that contribute to that. So it is the gun violence that they're seeing, but it's also, what do their schools look like? What is healthcare and job opportunities? All these foster conditions for gun violence and to be concentrated in these neighborhoods. It is not random at all. I always look at statistics that are disturbing. We know that gun violence is a leading cause of death for kids, teens, and young adults in this country, but Black children and teens are 14 times more likely than their white counterparts of the same age to die by gun homicide. And every 7 hours, a Black boy or teenager dies by gun homicide in the United States. And Black Americans, on average, 10 times the gun homicides, just in general, and 18 times the gun assault injuries, and nearly 3 times fatal shootings. And I don't have to go on and on, we get it. But I think it's really important just to think about what that means for limiting possibility, especially for young people. You're just barely surviving. You cannot thrive. And so I think, we have to have an approach that is very holistic, that is not only looking, as Representative Bush said, at just the important legislation and policies that are going to help. And not only those legislation and policies that will help, we have to make sure the folks that are most impacted are in the center of strategies so that we are not committing, like you said, policy violence as well. But that has to be coupled with looking at the healing and all the wraparound resources that a community needs. No one lives a single issue life, and all of these things coming together create a place where, folks are in cycles of violence. So we are doing all the work that we can and working in partnership with others on the front line. I heard Representative Bush mention some of the community intervention that happens with on-the-ground folks that are really literally putting themselves in front of bullets to stop these cycles of violence. So we have to make sure we continue to invest in those groups, those individuals, and those communities, as we're also walking along to push policy and legislation that we know will save lives.
Thank you. Representative Bush, you're on mute. Is there anything else you would like to?
I'm just like, come on, Angela.
Yes.
I just, your passion just, we all, we're experiencing your passion. But, again, ditto to everything that you just said. When I think about the disproportionate impact of gun violence on our communities and how, just like you said, Regina, it is a product of factors like systemic racism, which we know has historically marginalized our communities. And we speak about it all the time. All the time. It's in so many conversations, how it creates cycles of poverty and how it limits our economic opportunities. But we understand when communities are deprived of quality education, healthcare, the mental health services we need. I think about a story when I was working as a nurse at the community health agency. My patients, I would tell my patients, if you ever felt like, I think I want to hurt myself or someone else, call me. I would tell them, just call me. Just before you do anything, just call me, talk to me. Or come to my office. If we're open, come to my office. And there was this one instance where he came to my office. He said, nurse, he popped his head into my door and he just, nurse, today is the day. He didn't have to tell me anything else. But, and I said, okay. I stood up and he said, I'm going to kill 5 of my family members. And he walked out the door. I ran after him. Now at this point, we're out of the building. I'm running down the street trying to catch him. But the thing is, when we don't invest in the services that people actually need to be whole, when there is this underlying trauma, when we know that the community, the environment, the milieu that people are raised in, and what we are missing in our communities, how it just adds to it. And so when people are trying to be whole and we tell them, well, we can't give you medicine because you don't have the money. Well, you can't live here because you don't have the money. We over and over again, we put all of this extra baggage and burden on our communities instead of being that social safety net for those that need it. We're not fostering a climate of trust. When we have communities that face over policing and like aggressive law enforcement tactics, Again, we're adding fear and mistrust. When we heighten the surveillance because of that, we are adding fear. We're adding fear and mistrust, and so it only escalates tensions rather than alleviating them, and it increases the burden. And when we think about how when we add that to our reproductive futures, the resources that are needed in our communities for these things that will help to add to our social safety net, we can't get. Or we don't get, or we don't. We have people who are saying, "Hey, you know what? It's so violent in that community. We don't need to put more businesses there. It's so violent in that community. You know what? They're not going to put green spaces. They're not going to clean up the parks that we do have. You know, it's a violent community. We're gonna take away bus stops." Because it's, you know, because people, we don't want the buses to go that route. We're going to take away, you know, what makes a community the community. And so when we strip the community of its resources, but also we strip it of what makes it a community, when we disinvest in our communities, then we don't have, like you said, we don't have that, what reproductive justice requires, which is being able to live and raise our families in these healthy and safe communities.
Thank you. And, you know, I want to actually stick on that conversation a little bit more, which is, you know, a lot of people don't always understand that the mental health support and trauma-informed care is really integral to this work. So what are some ways, and I want to move to the latter part of this conversation to solutions and strategies. What are some ways we can ensure that that is integrated into our response to gun violence in Black communities? Representative Bush.
So one thing I'll say that has been an issue for me, it was really tough fighting this when I worked in the clinic setting. It took us a lot of work to get providers to understand why trauma-informed care was so necessary. If you don't believe it's necessary in this area or that area, I'm telling you it's necessary in this one. When I can open up my charts and it seems like somewhere around 80% of our charts, there is some type of trauma when I'm looking at the history of our patients. We need trauma-informed care should be how we approach people, how we approach their lives, how we look at how we are going to treat them, but also just how we engage them. And so trauma-informed care, it it is supposed to be in some of our states. I know I can't speak about all, but I know in my state it's supposed to be law, and we still have so many providers that don't understand why it's necessary. It's necessary that you know that yes, you're seeing grandma, but mom also has has some mental health issues that she's that we're trying to get her help for. And it's good to know that two of her children are also dealing with the same thing, and we're trying to get help for them as well. It's good to know that somebody else in the family, that dad, you know, it's good to know those things as we're trying to, like Angela said, making sure that we have wraparound services for everyone. But the trauma-informed care, the trauma-informed care is going to tell us what types of therapy we're going to, this family needs. You can't just throw meds at everybody, but you also can't say meds are for nobody. So those that need meds get meds, because to me, dealing with mental health issues is just like dealing with physical health issues. When you have a toothache, you need something for the toothache. You have diabetes, you need medication for diabetes. You have bipolar disorder, you need medication for bipolar disorder. But also, can we pray? Yeah. Also, can we believe? Yes. Also, can we have music therapy? Yes. And play therapy? Yes. And all of those things. But we get it when we have to make sure that the people that have access to the pen and the purse, that they understand why this is so important. Trauma-informed care, we need it in our communities. We have to advocate for it and make sure that they know why we need it and understand it. Show it to them. Bring them to the clinic. Bring them to the community center. Help them to see how prevalent it is in our communities, the level of trauma and pain in these communities. And I can speak to that because I'm one of those people, and have gone through my own gun violence situations where I was shot at, and I remember the bullet went past my head at the hands of a domestic abuser. And I just remember hearing the bullet. And I just remember if I'd have turned my head a little bit faster, that I would have been shot in the face. But that bullet missed me, thank God. But I get it that people don't want to invest where they feel like they could use money elsewhere to build up other communities and to allow our communities to starve and to die. Well, that's not us, and we'll keep fighting. We got folks like Dr. Angela here and you all as well.
Well, so you know what? Like I said, we've got people listening. What if they have said, you know what, some of these things resonate with me. Some of these things I'm experiencing in my family. What if they wanted, how do they ask for trauma-informed care when they go to their doctor?
Congresswoman, as a nurse, you should jump in first. I love.
Yeah. Oh, yeah. No. Yeah. I'm sorry. I was having trouble getting off mute. So the first thing that you can do is call so it depends on how you get to the clinic. So if you're going straight to a clinic, you can call that clinic and ask if they offer trauma-informed care. You can also call 211, most likely, which is that's the United Way, and find out like where are trauma-informed services in my community. And then if you want, if this is the clinic that I need to go to, or the provider I need to go to, then letting them know, hey, this is trauma-informed care. I've seen I've seen some research on this. What can we do to try to get this at this location, because I believe that this is what I need. Sometimes it's simply about letting them know. I remember when we switched to trauma-informed care at my provider's office, I'm the nurse. I'm the nurse. I'm not the doctor. I'm the nurse, but I was the one saying, I was listening to my patients, and I was crying with my patients because I'm like, we gotta do more. And so it was because the nurses decided we were going to press, because we were listening to those patients. So talk to the nurses, talk to the staff, talk to whoever the administration is, and let them know that this is what you want. But also go to your local council person, your alder person, whoever it is in that community. See if they will go with you. See if they will write a letter, because that's what we're for. We're to help you and to advocate for you, especially where those doors are closed.
Yeah, I think
Thank you.
that's great. I will just add quickly, not as not a nurse or a doctor or anything, but just as an advocate, and knowing that as far as experiences I've even had with healthcare, you have to ask questions. You just have to. If something doesn't feel right, it's okay. And you need to speak up. And I think oftentimes, especially with women, with Black communities, Black women, like we're almost taught to, we don't know what we're talking about. Right. We're gaslit sometimes in these spaces. Like,
So Angela's kind
no,
of
it's not
breaking up.
enough. You're not any experience, productive experience. I remember once with my I came in and out my internet. Did you see me?
We can
Regina?
hear every other word. We can hear, but
Hey, y'all, can you hear me?
Yes, we can hear you now. I believe the gist of what you were saying is that we're
Okay.
not listening. Sometimes we're dismissed, and that we have to be our own advocates, but please
We're
continue.
dismissed. Yeah, we can
Mhm.
be, we can be our advocates, and it's okay. And I know sometimes it's a scary thought to feel like you're challenging a doctor or someone, or like, I don't know what I'm talking about. If they write a prescription and you don't know what it, or don't quite understand it, you can ask. I think we need to just be our own advocates. We need to research. If you don't know, get somebody, get a friend, help out. But I think that's part of getting trauma-informed care, is that our own lived experience have to be a part of this. We have to be able to ask the questions and feel comfortable and safe. And another way is to have more people that look like us that are in the field of mental health or medicine, so that we actually have that connection. And we make sure, I know the women that I had when I was having my babies, my GYNs, were Black women, because I know that they were going to listen to me, hear me, and value what I had to contribute. And so I think that's important to note as well.
Thank you.
Regina, can I add one thing?
Absolutely.
When we talk about trauma-informed care, just so people understand kind of the difference, just I'll just give a really basic example. You walk into a mental health provider's office and you say, hey, I feel like I've been hearing things that are strange, or sometimes I feel like something's crawling on me, and when I look, nothing is there. I hear something, feel like I'm hearing sounds or voices, but nobody is talking. I look around and nobody is talking. And all of a sudden this just started happening. And then the doctor is like, oh, well, like, did your mom experience this? Did your family, they start asking all of these questions like that. No, 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 no. Okay, well, let's try you on this low dose medication. Trauma-informed care says and trust me, I'm not the doctor, but trauma-informed care is when the patient says that same thing, and then the doctor says something to the effect of, tell me about your childhood. What was your upbringing like? Have you ever experienced anything traumatic? Were you ever bullied? Did you ever lose anyone in your life that was close to you? Starts asking those questions to get to see if there is something else there that we need to deal with too. And come to find out, this person, witnessed their parent being killed in front of them, or different. And it does not have to always be trauma related causes or issues, in there. But that is the difference between trauma-informed care and then not having trauma-informed care. And then the trauma-informed care is going to say, well, we need to wrap around you different. We need to make sure that we're checking these other things in your life to make sure that you can be whole. It's not just about your mental health. What I can see right now, it's about your living conditions and all of these other things, these wraparound services.
Thank you. Beautiful. And so hopefully what the listeners took away from that is that is an effective strategy for ensuring that we have a holistic response to gun violence in our communities. I want to move on to talking more about effective strategies, but engaging young people in the fight for a fight against gun violence. What are you hearing from people, young people in particular, Angela and Representative Bush, when we talk about gun violence? And do you find that they have a better understanding of how gun violence is related to reproductive justice?
So I think just in general with young people with most issues, but specifically as I'm talking about gun violence, we just need to meet them where they are. I mean, I think you cannot come to young people and start talking about policies up here and what we need to do, or say vote, which we should be doing, but you have to meet them where they are. It's kind of as the Congresswoman was saying, this is like a trauma-informed way of also entering advocacy. There's a way to do that where you want to meet people where they are, understand what they have to contribute, and where they fit into this ecosystem. And we want to make sure we're giving them the opportunities to take on leadership. I love when people talk about young people as leaders, but often I hear the leaders of tomorrow. They're the leaders right now. They know what their communities need. They know what they're experiencing. And because this public health crisis is the burden is on their shoulders more than anyone in this country right now, they have to be part of the solution and strategy. So some of the ways that we do this are, first of all, just listening, and speaking to them through their platforms with authentic voices that they're going to actually listen to. That's social media, going to the schools or community spaces, speaking their language and making these issues feel relevant in their lives, which they are, but that we're not coming down and telling them something. We're engaging in collaborative conversation that actually elevates and lifts up the things that they already know that they need. So I think those are the ways that we have to handle, creating content, whatever it is. And we've done this. I talked about it a little bit before, but we had a Young Black Changemakers Summit a couple of years ago where we brought young Black folks we from HBCUs, but also non-traditional, like folks that weren't in college or were in community college. And we brought them all together to think about what it is that they need or what we can be doing in solutions to the gun violence in their communities. And it was just brilliant to see the ideas and the ways that they were already thinking about this, but they just didn't have the resources, or they needed some guidance so that the impact could be even be greater and they could plug into things. So I think when we have a platform to make sure we're giving space so that they can lead or be part of the conversation and the strategy is really important, and definitely meeting them where they are.
Thanks. Representative Bush?
Yeah, and I absolutely agree with that. We have to meet them where they are. We I think back to when I was a teenager, and um about 10 years ago, I started trying to remember how many friends I lost as a teenager due to gun violence. And I remember getting to about 30. Um, from age 14 to about 19, I could write down 30 names. And then once I got to 30, I stopped. Because it broke me down, just thinking about those who we lost. And then I made another list of those that went to jail at that time that are still in jail now. Um, at least then 10 years ago. And meeting them where they are, like Angela said, bringing them to the table. I remember as this was happening, and this was the 90s, it was the 90s. Gun violence was it was
Rampant, yeah.
really, really rampant.
Mhm.
And I don't remember many of the conversations bringing people like us to the table, people who were losing their friends like it was just a normal thing. Oh, such and such, y'all know such and such, they, like just over and over again, but we weren't being brought to the table. Not in the way where I felt that change was going to happen. I don't remember a conversation where people were saying, hey, we know this community has suffered a lot of violence. What, young people, how do you want us to move? And so that's important. We, in my office, we started, it's called Congress in Your Classroom, and we added a youth advisory council where we pulled high school students, mostly juniors and seniors, to come together from all over the district, who wanted to work on, well, first of all, who just wanted to just have any kind of experience what Congress does, but also make their voices heard. We wanted to give that platform. And what I said to them was, I want you to help. Let's put together a piece of legislation together. You tell me, what are your top 5 issues that you want to work on? Number 1 and number 2 of the top 5 issues that those youth wanted to work on was gun violence and mental health issues. And so we spent the next year, almost a year, working on legislation to do just that, and hearing their voices and crying with them and all of the things. But when I look at how this, when we talk about reproductive justice, we children in my state, children, but yeah, in my state have less autonomy over their own bodies. Women and girls have less autonomy and rights over their own bodies now than I had when I was 18, when I was their age. But then we tell them, oh, at any age you can have a gun in my state. You know what? You can also go to jail for whatever you do with this gun. But I don't trust you with your own body. I don't trust you to make your own decisions. So what is the message that's being sent to our kids? So when we talk about reproductive justice, we were pushing for reproductive justice. We thought we had reproductive freedom. We were pushing for justice. I was fighting for justice. And now we're rolled back to not even having justice, not having the justice, of course, but we definitely don't even have the freedoms. But our children can be harmed and hurt every single day at the hands of a gun.
Yeah. I mean, I think people don't understand. I mean, for children to grow up in a world where one day we are adorable and the next day we are irrationally
Right.
viewed as a threat.
Yeah.
and life just taken away callously. That is a reproductive justice issue. Not only impacts the children, it impacts parents. Then you understand why mothers are afraid for their kids to play outside. There are so many ways that it touches it. When women that are expecting or birthing people that are expecting, we know that the risk of gun violence increases during that time. So we really do work to try to educate on how holistic and this issue is and how it intersects with reproductive justice, gun violence, violence in our communities, and ultimately, how do we prevent it? And how do we figure out how we can work across all these sectors? And so I do want to leave some time for questions. We do have two more. As I said, we always like to end with solutions. Um, so what gives you hope in the face of this ongoing epidemic of gun violence? And how do you know, how do you think we can collectively work towards a future where all Black communities are safe and thriving?
I'll tell you what gives me hope. I think, first of all, looking at these faces, looking at Congresswoman Bush, looking at you, Regina, there's more and more Black women, people that are stepping up and leading in so many ways. And so when I look around and see my sisters leading in so many different sectors and across many different issues, I know that we're going to come to a place where we're actually not just solving the problem for us, but everybody benefits. When we are taking care of, everybody benefits is what we need to understand. So that's important. I also have hope because there are more and more women that are stepping up off the sidelines and getting involved, not just advocating. They might start by advocating. They might start by joining a community meeting. They might start by going to a school board meeting. And then they decide, I'm not getting what I need. I can do better. And they actually run for office and win. That's what they're doing. We have so many of our volunteers. We're in all 50 states plus DC. We call mothers and others, but we had so many, and organically they were advocating, getting tired of what was happening in the status quo, and they decided to lead. And we would run them for office. Now we're intentionally building these candidates and building benches from all the way down to hyper local to one of our first volunteers, and we're so proud of her, Representative Lucy McBath. But these people, these women in particular, are stepping up and doing this. I'm going to tell a quick story about Shondell Brooks, who is running for, I can't even remember the district. She's in Nashville, Tennessee. She is a survivor. Her son was shot and killed. And she is just so sick and tired and living in that trauma of it. But she turned her pain into purpose. And she decided she was going to step up and run for office. And I just left for the second time. I went to do some stuff with her campaign. I was there the last weekend, or this week, Sunday. And she was told, there's an incumbent, you can't do it. It's this, it's red, you can't be here, you can't do that. And we said, we're going to keep moving forward. We are going to keep moving forward. We don't want to hear no, because even if she were not to win, which she won her primary, by the way, y'all, and everyone said she couldn't do it. And now people are coming in and supporting her, and we want to make sure that she wins on November 5th. But that gives me hope, because we're not going to sit on the sidelines. We never have, if you're honest. We win elections, we take care of communities, we're the glue. And so I know that if we keep moving together, we're going to be fine. It doesn't mean it's not hard. It doesn't mean that there isn't pain in that, but that's what gives me hope. And we're not, like I said, can't stop, won't stop. We're going to keep going. So that's what gives me hope, Regina.
I love that. I love that. And yes, since you brought that up, Angela, I'm going to shout out someone as well. And of course, we all know how much you've inspired so many, and you definitely made this space feel like this is where not only where we should show up, but where we are welcome. Because oftentimes in movements, I'll just be upfront. It just feels like black to the back, and going all the way back, we think about, the suffragette movement and so much, and we can just look at, as movements since then. And so I'm So thank you for bringing that up. And so, yes, I have hope. And when I look at, I'm going back to my own community, and I'm speaking about my own community, even though this is an issue nationally, but I'm speaking about my community just because of the drastic change that has happened. Our mayor, her name is Tashara Jones. You were just on the panel, right, with Tashara, Angela?
Yes, I love her. She's amazing.
Yes, for CBC Week.
Yes.
And our mayor, who is a dear friend of mine, it matters who's in the seat. And it matters what they plan to do, but it matters what they were doing before they were ever elected. And so, you know, I had my desire to push forward. And I have a bill called the People's Response Act that people on this call know about. This bill would take it would redefine public safety as a public health issue, and it would remove this work from the Department of Justice to the Department of Health and Human Services, and would have put a crisis response team on the ground that is culturally competent, but also understands the needs of those communities. So making sure that people where English is a second language, or people who are unhoused, people who are living with chronic and persistent mental health issues, and so on, that we are prioritizing them with making sure that when they call 911, if it's for a mental health issue, if it's because they're unhoused or whatever it is, that we're sending out the appropriate response instead of sending out a carceral one. And so I've had those conversations with our mayor, and she said, you know what, let's go to Denver and let's go meet with those that are running the Denver program. We met with law enforcement, we met with providers, we met with clinicians, and they talked about the success of what was happening there. And we implemented that, even though my bill has yet to pass Congress, we implemented that in St. Louis. And let me say this, crime is down for the first time in this way. We have not seen a drop in crime in 10 years. It's been 10 years. Crime is down 22%. Homicides are down 22% in Missouri just since she and I have been in office. We have not seen this type of these numbers in over 10 years. And I'll also say the community is safer, even though we have a long way to go because we were far gone. But change is happening. It matters who we elect. It matters, like Angela said, who we put in these positions. And women are stepping up. Black women are stepping up because we understand that we are some of the ones that have the most to lose. And so we're putting ourselves on the line in several ways. And so for the first time that I can remember, St. Louis is not in the top 10 most homicides in the country. Not only that, I was in Mexico just 2 years ago, and the president said to me in a meeting, he said, how can you come here and talk to me about crime when St. Louis is number one for homicide in the world? No longer. But I bring that up to say, it's because people who care and are ready to put themselves on the line, ready to push forward and add policy to action. This is how we get it done. So I'm hopeful. I'm hopeful because these folks are living right now for such a time as this, because Angela is here, because Regina said, let's open up the space. And in our own voice said, this is the space, and this is how we need to open that up. I'm encouraged and I'm hopeful because all of you care enough, because you came on this call to hear and to learn and to go spread that word. And so I'm encouraged because we are here still yet to do the work.
I know that's right. And I just want to add on to that. You got me fired up, Congresswoman. We cannot be hanging out together because I don't know what we will get into. Just to be,
let's do it.
to be clear, but this is hard work, but it's heart work. And when you come into work with that passion, with that heart, leading with love for our community. And like you said, we're going to put our lives on the line because it is our lives on the line. Like we already are there. And also I heard you talk about this, and Regina, you also alluded to it. When we have the crisis such as gun violence in this country and any other crisis you think about, when we're approaching this with a punitive response, we're not saving anybody. We're deepening the inequity, we're deepening the trauma and the pain. And so what the Congresswoman just talked about is doing that hard work as hard work, which means that we're actually coming to heal. We're coming to heal. We're coming to bring solutions that we know are going to impact and change the status for folks, change the outcome so that people are not just surviving, but they can actually thrive. So punitive solutions are not going to do it. And for the longest time, especially when you think about gun violence, they're looking down at perpetrators or like sentencing and all that. And I'm not saying those things aren't important to think about or understand, but I think if we are just leading from that place, we are never going to solve this problem for ourselves. So that's why we're seeing success in those places, because you're wrapping around people, you're humanizing people, and you're taking their lived experience and the trauma-informed way and making sure that we are providing for them so that they can thrive. When they thrive, we all thrive.
Wow. I could listen to you all night, and I just looked at the time, and we have literally 6 minutes, and the Q&A is on fire here. So I'm going to kick it over to our moderators to see if they can scan through quite a few of the questions have a similar theme. Can you all
Yes.
help me out here and see how we can
Absolutely.
get a few of these questions answered? And
Can
maybe
you
you all
hear me?
can stay with us a couple of minutes over so that we can get some of these. But everyone, this is an amazing chat, and I so much to learn. And so hopefully we can get through some of these.
Yes. Thank you everyone who's been asking questions. Apologies, we will not be able to get to everyone, but we've been sort of compiling questions that have similar themes, and we'll try and get to as many as possible. I do again want to reiterate that this conversation is off the record, and none of the things that have been said tonight or the questions are approved to be used in the media without express permission from In Our Own Voice or any of the panelists here. So the first question that we're going to get to is a two-parter. How do we address the glorifying of guns and new groups like gun clubs that are recruiting Black men and women based on fear? And then how do we hold our own family members accountable when guns are so glorified and seen as a necessary civil right?
Yeah, it's a tough one, and I'll talk a little bit about why. I think one of the things we saw, especially coming out of the pandemic, is that there's more Black women in particular that were becoming gun owners, new gun owners. And this is it's not because I think when we think about fear, especially in Black communities, it's a little bit different when we're thinking about the othering in some communities that we might see. But it's because we've done a survey on some of the communities, and we're actually doing what we call a BIPOC gun owner, some data and research on that. And that's for Black, Indigenous people of color, in case people didn't know what BIPOC is. But what we're seeing is that the safety, it feels like they don't have anyone to come for them, to come help them. Calling the police is not an option. Like what are I supposed to do to protect myself? And so what we have to do is change the conversation. And some of the things we already talked about today are part of that. It's like the solutions are holistic, meeting people where they are, first of all. We are at Every 10 for Gun Safety. We aren't anti-gun. I have gun owners in my family and Moms Demand Action. We're not anti, but what we are is for responsible gun ownership. I don't think a gun belongs in everybody's hand, frankly, especially when we think about young people. There's some states where they have, you can't get a handgun if you're until you're 21, but at 18, you can get an assault rifle. Now tell me how that makes any sense. So I think we just have to have, yeah, exactly. Scratch your head on that one. We have to think about policies that are going to help to regulate when we think about the industry here. No other industry has immunity like the gun industry. And they rake in $9 billion a year, and blood is on their hands. They're part of devastation in community. We don't have to pass laws. Some of these things, they can just innovate towards safety. It's that simple. Like for instance, Glock, it's a popular handgun, but they know that they have a design flaw where you can put a cheap plastic piece in and essentially turn it into a machine gun. And we have our litigation team at Everytown Law. We have a case where in Illinois, also in New York, and we are going after the industry on some of these things because they actually can do better. So instead of being punitive, we're trying to go after industry to innovate towards safety. I think we're going to educate people on what it means to securely store your firearm, not have it on your nightstand or under your mattress or in the glove box. There's a growing number of thefts from automobiles. They're not stealing phones or anything else. They're not even stealing the car. They're looking for guns in them. So I think we have to make sure that if you are a gun owner and a new gun owner, you really interrogate and think about what is that responsibility. You have the proper training, and you really think about what this means for you, because it is a responsibility once you take it on. So I think there's lots of ways to approach it, but we're looking at it holistically, looking at the industry, making sure there's not bad actors. We know a lot of times we look at some gun sellers. There's just a handful of gun sellers that can be traced back to the same, like, crime guns. And so what the hell is that? We need to get with, like, straw purchasing and trafficking. There's so many things. Again, this is looking at the bigger picture and not just being punitive and looking at the person that, you know, had with a gun charge. That is something that's important. But if we're not looking at this holistically, then we're not going to solve the problem. And we're constantly just going to be going downstream and doing more harm to communities, when we need to be thinking bigger, and how we're educating and how we're going after the industry that can innovate towards safety and do better.
Thank you. I'm going to direct the next couple questions to Representative Bush, especially because of your medical background, and I'm going to combine two questions. So someone asked, Medicaid reimbursements are so low, but the cost of culturally competent trainings are so high. How can we provide culturally responsive resources for our providers in the community to ensure that diverse experiences are properly cared for? And then a second question, it's a little close, so I think we can tackle them together. In regard to reproductive justice, is there a legislative push for doulas and midwives in birthing spaces to be recognized and supported on both state and federal levels? So one is about culturally competent trainings for medical providers, and the other is alternative birthing providers.
Okay, so as far as the trainings are concerned, there is a lot of work that has to be done in that area. Let me just be clear, because we need, we need more funding that will, as an incentive, for these clinics, for hospitals for the providers to want to take these courses, and to be culturally competent. But we first have to make sure they understand why they need to be culturally competent, because that's some of the issues. I went to school. Like, I already did you're not a doctor, I am, and I'm thinking of conversations I've had with providers myself as the nurse, and they're looking at me like, why are you trying to tell me, how to treat this person? Why are you trying to tell me, that I can't call this person John when the chart says John, and I'm telling you she does not want to be called John. So there's a lot of education, but I think the incentive, so more funding on the federal level, and funding that actually reaches local community based agencies and such, to be an incentive for them to be able to hold these types of trainings, and then making it mandatory that they take the trainings, and I will say in some instances, of course, in some instances this is happening, but it's not enough. So that's why we're not seeing it to filter through as well as it could. And I'll say, as far as legislation as it relates in regards to doulas and such, so we're working on that. We're working hard on that. I know the Black Momnibus and so much of work from Representative Ayanna Pressley. She has legislation. I have legislation where we actually fund doulas, where we actually so not just through like making sure that they are able to be recognized by Medicaid, but also that they are able to receive direct funding through the federal government. So we're working on it in several different ways. We've looked at it. I know I have legislation that would, this one is for wraparound services for someone who is seeking abortion services. And this is to wrap around that person. So making sure they have money for transportation, money for mental health services, money for childcare, all of the things that they would need to, maybe for those that need to travel to go have those services. And a part of that is being able to pay a doula take care of them. And so, and actually I've gone to, I know there's this really, Jama Birth Village in St. Louis. It's just a really, really great facility. If you have a chance to look them up, they offer so many services that go even beyond the doula care for somebody who is currently pregnant or just who is just delivered. So being able to fund that in a rich way was actually on my to-do list. And so even though I won't be back in Congress in January, I'm hoping that someone else will pick that up, because groups like them, they are doing the work to be able to make sure, just like Angela said, she knew who to call because she wanted to make sure that her deliveries were healthy and safe. And she knew who to call to make sure that that happens. And we know that Black doulas definitely help us to close those disparities with maternal mortality and infant mortality rates.
Absolutely. And you know what? It is 8:05. I want to respect your time, and we never end without our call to action. So I'm going to turn it over to Montserrat to give our call to action. Thank you again. This was an amazing conversation. It's hopefully the viewers come away with lots of jewels, more empowered, more fired up. We've got 2 weeks now, and we are going to be marching into those polls, making our voices heard. Montserrat, take it away, please.
Thank you, Regina. So again, thank you to everyone. We had over 30 questions, so there's no way we could answer all questions. But we really appreciate your time. We appreciate you all being invested. And the way to, sort of get your questions answered and continue this conversation is to stay involved. And so we know that the fight to protect Black women, girls, gender expansive individuals, it requires collective action. We all have to work together, and we can't sit on the sidelines. So we just have a couple points here on how we can get involved. Number one, support candidates who support us. We have 14 days left until the 2024 election cycle. And so it is important to check out the endorsed candidates that In Our Own Voice Action Fund has endorsed, which are on our website, blackrjaction.org. And also read your ballots and find out who in your community supports the policies that you care about, and make sure that you cast your vote, and make sure that the people cast your vote. We had a lot of questions about, how do I inform my community? How do I tell people, in my community not to vote for this person or to support this kind of policy? And the answer is just conversation. We also want you to stay informed. Read the Reproductive Justice Policy Agenda, which can be found at this URL here, blackrj.org/BlackRJ Policy Agenda. Keep up with In Our Own Voice Action Fund. Register for our next session, which is going to be about environmental justice and the importance of having communities that are safe for our physical bodies, like that we can literally breathe clean air. And spread the word about the work that we're doing with the people in your community. We will be sending a recording of this conversation through email, along with some talking points that you can use when you are having these conversations, because we know sometimes what you feel, but you don't necessarily have the words to say it. So we'll be sending some information around. And In Our Own Voice Action Fund is really here in this fight, and we want you all to be a part of it and to be part of our community. And stay connected. Please follow us on social media. Follow Dr. Davis Moss, as well as Moms Demand Action, and Angela directly, as well as Rep. Cori Bush. We really hope to see you all next week, and we just want to thank you for your presence. This is a great conversation. Representative Bush, can't thank you enough. Your words are really inspiring. And Angela, you I feel it, right? Like when you talk, you feel it. I know how much you care about this and how much you care about our communities. And if you want to say any last words, please feel free. Otherwise, we will end the session here.
Thank you. What an honor to be with you all. Thanks for everyone that joined. And Congresswoman, always a pleasure and honor to be with you. Thank you, Regina. Thank you, everybody. This is great.
Thanks again, everybody. Remember, our power, our body, our vote. Have a good evening.